Hi, my name is Sarah St.clair. I chose to do my project presentation on asthma, the risk factors, symptoms, treatments, all that good stuff. All right, so let's get started. So, asthma is a chronic disease that causes your airways to become inflamed, making it difficult to breathe properly. The word asthma is from the Greek word meaning short of breath. Asthma was discovered in the 19th century, written in a publication by Herbert Hyde Salter. Asthma has around 3 million cases per year in the US, and most of the time is undiagnosed by many people. Many people do not know that they do have symptoms of asthma, and so that is why there are many people unrecorded because they have not got the proper diagnosis from a doctor. So on the Asthma and Allergy Foundation of America website, they said there is about 6.2 million children under the age of 18 with asthma in 2017 alone. That is a lot of children. Asthma does not affect everyone the same. Most people don't even know they have asthma until a trigger happens. Asthma triggers can cause an asthma attack, which is pet dander, smoke, any chemicals, weather, dust particles, anything of that sort can cause a trigger, which can then cause a reaction in your body, which may cause your airway to close or you to cough a lot. It's a really uncomfortable feeling for many people. So, a person's airway during an asthma attack will narrow itself down by contracting the muscle wall, secreting the mucous membrane, causing the airway to become small. So, let's just say this is your airway for a second, nice, big, perfect round, and then a trigger happens, and all of a sudden your airway begins to fill with this weird stuff, and it gets to close, and now it's super, super small and you have to try to breathe through this tiny hole. So that is what it feels like when your airway becomes super small. The obstruction of the airway can lead to wheezing, breathlessness, and a cough to catch your breath. So imagine trying to breathe through this really, really tiny hole properly. Doesn't work at all. Symptoms of asthma include a hard time breathing, but also can make your face become blue or pale in color. The body begins to weaken itself by the lack of oxygen reaching the lungs. So because of your airway being small, your body is working extra hard to get oxygen into your lungs, so you will see an increased heart rate. You will see the chest and the ribs excluding out of the body and not being able to go in all the way. You will hear them wheezing, which is a high-pitched sound that goes out of the mouth. You will often see them blue in their face because they're not getting that oxygen flow, and also that blood flow is kind of just going back and forth. The fatality of asthma has caused over 3,564 deaths in 2017. According to the AAFA, which is the Asthma Allergy Foundation of America, adults are 4 times more likely to die from asthma than children. These triggers are often missed and avoided until something triggers the asthma, which causes a reaction. There are many other types of asthma, but I have a couple that I'm going to let you guys know. So adult-set asthma is mostly diagnosed as an adult, obviously. There are around 19.2 million adults diagnosed with asthma in the US. That's about 7.7% of adults with asthma. Adult asthma is often misdiagnosed by other health-related symptoms that doctors often diagnose to adults 20 years or older. Many doctors do not believe that adults come in or develop asthma over time, so they begin to diagnose them with other health-related issues, which is not the case, and most of the times, in the end, it is asthma. Another type of asthma is an allergic asthma. Not everyone has asthma with allergies, But allergens like pollen, pet dander, and dust can trigger these reactions, especially during springtime when the flowers and the pollen's all out. A lot of people begin to recognize that they do have allergic asthma, and that can cause really bad asthma attacks. Also too, pet dander. Pet dander doesn't count just as hair, but pet dander also comes from the skin of an animal. It could either most likely be cats, dogs, um, any small rodents or anything like that. They all have pet dander. So if you do have allergic asthma, make sure that you get a pet that does not have dander or does not have like a lot of allergens in it. Children are most susceptible to allergic asthma because of their growing immune system. 90% of children are diagnosed with allergic asthma under the age of 18 years old. Wow. Allergists can create a way to best help you with your asthma. Asthma will most likely not go away on its own, but it can be avoided by limiting your time near the triggers that can cause an asthma attack. So make sure if you know that there's animals around and you have allergic asthma, make sure to avoid those animals. Do not pet them. Maybe have them outside. Stay away from them, especially during springtime. Make sure if you have allergic asthma, have your inhalers with you, have your medications with you, or try to limit your time outside to avoid those triggers that can cause an asthma attack. Okay? The causes of an asthma attack are different for everybody. Even completing the same task may make a person react to a trigger. But sadly, there's no cure for asthma. But with the correct management, you should be able to avoid major asthma attacks. Doctors can help you and your family create an asthma action plan to keep your asthma symptoms in check. Medications, inhalers, and avoiding your triggers can help the symptoms of asthma. Long-term medications can reduce the amount of swelling in your airways. Inhalers may need to be used for the rest of a person's life to help them with these reactions, but it is worth it because if there is no cure, then you need these long-term medications to keep you safe from having a severe asthma attack. Albuterol is a type of inhaler for an allergic asthma that it can be prescribed by your doctor. Make sure you ask them and they will diagnose you with the correct type of asthma you have and also give you the correct prescribed inhaler or medications. They will provide you with all the options and make sure that they pick the best for you. Asthma is not a simple fix for many people. Asthma is a serious disease that causes severe health problems. Asthma attacks are not fun to go through, which is why many people need to be educated on the effects of asthma. From my own personal experience, I have been in sports and been very active from the ages of 8 to 18, and at the age of 19, I was diagnosed with allergic asthma due to a horrible asthma attack during a track meet. I was unaware that I was having an asthma attack and did not know that I could be affected by it because I was a healthy girl. I've gone to doctors and been prescribed inhalers, but I still do live every day with slight breathing problems and heavy breathings. So asthma can affect everyone. Doesn't matter if you are the healthiest person in the world, you eat a vegan meal, all this kind of stuff, you still can be affected by asthma. Even if it is just minor symptoms, you still need to make sure because those minor symptoms can soon turn to major symptoms and cause an attack, and you are not prepared with the correct medications, inhalers, or any treatment plans to help you. So, asthma can happen to everybody. You need to make sure that you are educated and go through all these lists and see which one is your trigger. All right? All right. So I hope that you guys learned something about asthma. I know I did. um, so some of my works cited that I use actually for this presentation was I went to the Centers for Disease and Control and Prevention, and I looked at the asthma frequently asked questions. I also went to Asthma, AAAAI, the American Academy of Allergy, Asthma, and Immunology. I also went to the AAFA, which is the Asthma and Allergy Foundation of America. All right, that's all I got for you guys. Thank you and have a good day. Bye.